Mbulaminaka, and of course, welcome back to our series, Oral Health and
Overall Health.
We welcome you and thank you so much for joining us again today. We will be looking at another aspect. We're still looking at oral health, but how it affects other overall health or other parts of the body. And of course, we welcome our guest, Dr. Nimaya Mbulaminaka. And yes, so today we will be looking at oral health and brain function.
Yeah, right.
Yeah, we
are the neighbors.
Yes, yeah, true. In our last episode, we were looking at the connection between oral health and the
heart.
So today we are looking at the brain.
Yep.
Yeah, where we think. So tell us a little on what we are going to see today.
Okay, we are going to talk on the neck top approach, your brain and your mouth. Yeah, and we can see that these two parts of our body, they are just a handspan. Yeah, just your mouth and your head. Okay, the brain and the mouth are the neighbor, right? Brain and the mouth are closely linked through nerves and blood vessels, and that's in the network of how we were being made. Yeah, the nerves and the blood vessels all over our facial system and all over our body. And we see, and the blood system, and it's being pumped by the heart. As we throw back to last episode, and then the nerves from the brain. And for each tooth has got blood and nerve vessels and lymphatic system. So we can see here, the brain and the mouth are closely linked through nerves and blood vessels. One of the key pathways is the trigeminal nerve. Yeah, this is a nerve on our face. It's the trigeminal nerve connecting the jaw, the teeth, and gums to the brain. Yeah, and so through the TMJ, which is the lifestyle joint, and that's where the trigeminal nerve connecting the jaw, teeth, gums to the brain. You see, every final aspects of our being has been supplied with nerve and blood vessels, connecting to the heart and to the brain. Yes.
While you were speaking, Doctor, you know the connection. When you get a toothache, man, it's like
your whole body is sick.
It's my whole head. Like I have a headache, and my whole body is just sympathizes.
Shut down. Sympathizes.
Yes.
That's the word.
And of course, many people don't realize that infection and inflammation in the mouth also impacts the brain health.
Yeah.
And contributes even to Alzheimer's, a condition for Alzheimer's.
Yeah, forgetfulness. Yeah.
Let's explore further this connection. You've given a bit of explanation there.
Yeah.
And,
because
the same nerve you talked about is responsible for sensation.
Yes, sensation. Yeah, because we are looking at the brain, and that's where we think. Yeah, we even remember, and our oral health is connected to our brain function. Yeah, as you've already said about that link. About this trigeminal nerve. Yeah, connecting the jaw, the teeth, the gums to the brain. Sometimes some people think, oh, the teeth is just that white, looking good part of the body, and it just got no blood vessel. No, it has blood vessels. Each tooth has got blood vessels and nerve vessels.
It directly.
Yeah, and when it deals with blood vessels, it connects to the heart, and with the nerve vessels or the nerve tissues, it directs to the brain. Yeah? And we can see this trigeminal nerve. That same nerve responsible for sensations in the face. You see, we got our emotions.
When you smile.
Yeah, when you smile.
All the nerves relax.
Right. And all our emotions. Yeah. And it's more than this. It's more than that. Research shows that bacteria from the gum, can enter the bloodstream and travel to the brain. And it can causing inflammation.
So the inflammation here in the mouth,
Yeah.
once the bacteria travel through
Yeah,
the
it can
bloodstreams,
travel even right to the brain.
and then they go and cause inflammation in the brain.
Right.
So sometimes we wonder why we get headaches.
Yes, sometimes.
We get dizzy and all that. This
Yeah.
is where everything begins here in the mouth.
Right.
You put things in your mouth, you must remember that it's going to affect all the
Yes.
other parts of your body. Okay, Doc, studies have even found traces of oral bacteria in the brain tissue of Alzheimer patients. Well, just tell us
It's
how
very,
that happens.
yeah, it's because we can see that oral bacteria, it's oral bacteria, it's bacteria for the mouth, that's their home.
Yeah.
And then with the lifestyles we are doing now and some of the factors in life, and these bacteria tend to leave their normal
Habitat.
habitat, they travel.
They go and live in the other part.
Yes.
Which will cause memory loss.
Yes, it can affect
cognitive, decline in your thoughts.
Yes.
Thinking, your strength for thinking.
Very true.
Your ability to think is affected from, it's not old age, it's actually what's here in the mouth.
Chronic gum inflammation may increase the risk of memory loss and cognitive decline. It is chronic, Yeah, chronic gum disease. There's tissue issues of the mouth that is neglected, and then it can affect your brain function.
Just repeat it in Fijian for our
Okay, for our viewers. Nabika ke de ade nungsunda na sinchuke nungsunda. La kusaranga kinonda uto e la telanga kinonda mon sinonda bakasama ayo. Nabika ke de takati ko na lomo nungsunda.
na matenga itiki na matini gam na matini.
Yeah. Erenda toso.
Na lako na nonda sal nindra.
Breta nindra ya wala toso toso chunga.
Yeah, okay, thank you for that.
Yes.
Let's have a look at the TMJ and headaches and mental health.
Yeah.
We get headaches, yeah? Now, let's talk about the jaw joint, the TMJ.
Okay.
When it's, it can cause more than just the jaw pain, right?
Yes.
It's a big word there. Misaligned, when it's misaligned.
Misaligned, and I know you are talking from experience, eh?
Yes.
Yes. And yes, temporomandibular joint, the life joint or the lifestyle joint, the mouth joint. Okay, when it's dysfunctioned, when it's normal, then when our TMJ is normal, we don't take it seriously. We take it for granted. Yeah, like right now we are talking, we are just smiling and we are giving out information, then we just, because everything is, but if it becomes chronic dysfunction, it can trigger chronic tension of headaches, migraines, and affect focus and mental clarity.
So you can think clearly now.
Yeah.
Once this one,
it's dysfunctioning and yeah.
Mesin
Yeah.
Na numu joint go.
Yeah.
Sana le roni babu na mosini ulu. Na mosini notanga boka.
Sini focus not bakasama.
Okay, so there's a whole lot of side effects when we do not take care of our mouth and our joints here. Okay, so that's because the muscles involved in chewing connect to the temples.
Right.
And the skull. And if they are inflamed, it creates tension and radiates to the head.
Yeah.
Okay, so Doc, talk about this chronic pain.
Yeah, chronic pain, as we have said, is something ongoing. It have taken...
Once that happens.
Yeah. And chronic pain, even in the jaw, can lead to fatigue, and anxiety and stress.
So when you get that, it leads to tiredness.
Yeah.
Anxiety.
Anxiety. Lomalenga,
Stress.
Yes, true. They all, there's a pattern.
So anything that has to do with the brain brings in stress. So now you're going to have high blood pressure when you're stressed out. So let's control what we chew. Don't put too much food in your mouth because it will exhaust your jaws,
Yeah.
opening and closing and chewing. Let's have a look at the prevention and healing. Yeah. So how do we protect our brain by taking care of our mouth? Doc?
Okay. First, taking care of our mouth, one of the very important thing that we should be doing is prevent gum disease. And preventing gum disease is by toothbrushing and flossing and eating of fibrous foods, healthy foods. Okay. And then if the disease is onset, we must treat the disease early. Don't leave it for too long. Yeah, then it becomes very difficult to. So that's why when the gum disease starts early, when you see bleeding, mild bleeding and mild pain, then you should start preventing it. First, treat gum disease early. Don't ignore bleeding gums.
Don't ignore bleeding gums.
Yeah, because that's not normal. And one of the ways to avoid bleeding of gums during toothbrushing, use soft toothbrush. It really works.
And then just avoid eating food that will...
and avoids eating foods that will aggravate the bacterial work. Yeah, like processed foods and all this sugary.
Yeah, another advice is for us to manage our stress level.
Yes.
Yeah, because stress is a major cause of you grinding your teeth, clenching and teeth grinding.
True.
When you are stressed, starting with kachibachi and all that, and that's, that is causing a lot of stress here in the mouth and for the jaw.
Very true.
Okay, so we have a Bible verse there, Doc. Would you like to tell us about it?
Oh, that's Proverbs 17:22. It says, "A cheerful heart is a good medicine, but a crushed spirit dries up the bones." You see, our bones is all over our body, the bones,
So
and
the
then
bones,
and a cheerful heart, then it's a good medicine, but a crushed spirit dries up the bones. Mental peace and physical care go hand in hand.
They manufacture what in the bones, eh?
Yeah, in the marrow,
bone marrow.
yeah.
That is where the blood things manufacture.
Yes.
Eh? So when the bone is crushed, poison comes about.
I remember.
Blood poisoning. Yeah.
I remember this. Okay, we take the teeth. The scenario when the nerves in the teeth is diseased, and then the tooth becomes dry. There's no life, eh? Yeah. So we can see here that cheerful heart is good medicine, but a crushed spirit dries up the bones.
So once the bones are dried, that's it. You're dead. Yeah.
Yeah.
Because that is where the blood
produced and
platelets are produced, and they supply the bloodstreams.
Right.
And they go to the heart when they are not being produced. So you are short of it. Okay, so let's have a look at real life applications here. Let's say someone has been struggling with forgetfulness, and also has gum issues. Could the two be related? No?
They could. Ongoing gum inflammation can produce cytokines. Yeah. They're chemicals that travel to the brain and affect memory.
Okay.
As we have been said, what happens in the mouth travels.
Okay. So that you really need to take care of your gum, because
we need to take care of the gum, which is the skin of the teeth.
Yeah. So caring of the mouth might help protect the mind. That's it.
Yeah, it says that it might help.
Protect your mind. Your mind. Take care of your gums.
Yes. And I vouch for it. And one lady, just a scenario, a lady told me and us a story, and she was being tasked to go and look after one lady who is like, stroke, and then not responding. And then they told her, okay, you come and look after her for only 3 weeks or 4 weeks, then she'll be gone. and then
That's it.
yeah, that's it. But when she came, the first thing that she did to the lady, clean her mouth. Yeah. She said, I clean. I use about 3 bowls of water, or 5. Change. Clean the teeth, the gums, the tongue, and changing the water. And straight after that, the lady started doing this. She was not talking. This, she started making that sound. And yeah, and the lady said, and she goes on looking after this lady for 4 years.
So she went for 4 years.
Yeah.
Instead of just 1 month or 2.
Yes. And then she's talking, she eats. But before that, she was not responding to any of these.
So it all started here in the mouth.
Yeah. So I can connect that story to what we are going through now.
We have a Bible verse there, Psalms 94:9. Doc, can you just help us with that verse there?
Okay. Does he who formed the eyes not see? Does he who formed the ear not hear? God created us with interconnected systems that all need care.
So you take care of all your different systems.
All those different
because
systems.
They all work together.
Yes.
Yeah. Okay, we have some questions here. Some questions we need to ask ourselves. And the question we should answer ourselves. And the first one here, have you experienced frequent headaches and jaw pain? Have you experienced frequent headaches and jaw pain? Okay, so what can we...
Yeah. Yeah, I was just talking to a lady too, and then she told me, I always experience this pain around my jaw and headache. Then she told me that someone have hit her, like punched her.
Disconnected.
Yeah, and then and she's saying through this our program, they said, I'm happy now that I can know. Yeah, because of my TMJ has been dysfunctioned.
You know, we have this abuse, physical abuse.
Physical abuse.
And often, you know, we key the ear of the child or we slap the ear. No,
that's very bad.
Dangerous because
that's very bad.
Affect the brain.
Yes.
It'll affect
and physical abuse and verbal abuse.
Yeah. Okay, so if you now have that, then you need to suspect that there's something, the jaw may be involved.
Yes.
Yeah. And stress can come in, so you need to remember that. And you need to pay attention to it and try and address it. Do you or a loved one show signs of memory loss or brain fog?
Yeah, I think the story that I just tell, it suits this one very well.
Yeah, so, you know, health can be a factor. So when you begin to forget things, then you remember it's the cause is here, the root cause is here in the mouth. So just take care. The jaw and the mouth. What you put in and the gum, check it.
Yes.
Make sure you clean your teeth regularly.
Amen.
How often do you floss and brush thoroughly?
Yeah, that's a very, it should be twice daily for brushing and floss daily. I think this flossing, we are not really into it.
Yeah, not into it.
Yeah, but it makes wonders. Yeah, it makes wonders. Because a study shows that toothbrushing accounts to about 70% of teeth cleaning. And where the brush does not reach, it's where the flossing will do the work.
Okay, so another question. Do you grind your teeth at night or clench during stress? You know, when you're stressed, you start grinding your teeth. Yes.
Yeah.
Then,
when the teeth grinds, or when the teeth, you know, that our teeth hardly touch each other, there's always a space. That's a rest space. But when our teeth touch each other, then we clench, we grind, and then when the teeth touch each other, it makes that awful sound, and it's very hard for the muscles and for the connective tissues and for the nerves, because that's why and that's why some people got into this very tired jaw and their muscle tension. Sometimes it's due to they're going through stress, and that's why their teeth clenched.
So, folks, just remember, friends, that there is a connection between your mouth, your jaw, and the brain. They are neighbors.
They are neighbors.
And you need to take care.
And
when you have a headache, there is, that is a sign that something is wrong with your facial hair. Or the source may be coming from some other parts of your body.
True.
Let's have a look at, just for the few minutes we have left, let's have a look at some spiritual lesson.
Yeah.
So Romans 12 Doc, what does it tell us?
Oh, it said this wonderful application, be transformed by the renewing of your mind. Be transformed by the renewing of your mind. A healthy brain supports a renewed and focused life.
Yes, so
Yeah.
a healthy brain supports a renewed, focused life. So let's take time to take good care of our mouth, because it is important that you keep your brain healthy. Alzheimer's, you become forgetful when the mouth is not taken care of. They will send all those, what do you call them?
Cytokines, eh?
Sent to the other parts of the body through the blood vessels. And we need to remember that. And, thank you so much, Doc, for sharing all that. And in our next episode, we'll be looking at the mouth in connection to other parts of the body. And when we come to that time, we'll see our friends again. And thank you so much for joining us today. Remember, the mouth is connected to the brain.
Mo demanda.
Yes.